Hi everyone, I'm Stephanie McBride, and in this video I'm going to share with you my very favorite oil for lactating moms, especially when you have a new baby and you're getting over the first few months of like a lot of different discomforts that pop up and things that happen that you may need a little bit of extra support with. This oil is so remarkable because there's literally no other time in life where I can think of one oil that kind of handles everything that may come up for you. For example, in pregnancy, I could not have someone get a list of one oil and walk, or even two. Like there's so many different things that happen. You need at least 5 oils to take care of your birth kit for pregnancy. But if you are a nursing mom, this is one single oil you can put in your diaper bag or in your purse, and you can use for everything from risk of infection to chapped nipples to engorgement to little milk supply to weaning a baby. It's just such a great oil for all of those things. And it is geranium. So geranium is also great if you don't get a good night's sleep. So when else during life than like postpartum when you have a new baby waking you up do you especially need this kind of attribute? Geranium can be used for sleep by just putting a drop in your hand and then holding your hands to your nose and taking a deep inhale. It's also such a gentle oil that you can rub it into the back of your neck and your chest. And like I've actually massaged it into my scalp. That's very relaxing. And I put it on my pillow as well. You can take a bath with it. You can have your partner or your toddler or do a self-massage with it before bed. So it will help you if you're someone who gets a second wind, or maybe you're just too tired to sleep, because it does lower nighttime cortisol levels and also helps you to sleep more deeply. So hugely restorative in postpartum, apart from things that come up with nursing. It can help with nursing with things like chapped nipples if you add a drop to some kind of natural nipple cream or ointment and just apply directly. And I'm going to share some safety tips about applying to the breast in just a second. Also, with engorgement, it can be nice cold, so you might mix it in with about 16 ounces of cold water or put it in the refrigerator with a glass jar with a lid on, cold water. And then you can either shake it or you can add some kind of emulsifier like glycerin to help the oils mix with the water. But at that point, you would just want to take a cloth and actually like soak it in to the mixture and then apply it sort of as a cool poultice on your breast for engorgement. It can also be used to increase milk supply, and it's actually seen as a balancing essential oil with this regard. So it's also used for weaning, and it can just be more for regulating breast milk production. Now, if this doesn't work, there are other oils such as fennel that can be used, and basil to help increase milk supply. But you may as well try with geranium first. And how I would recommend doing this is to mix it with a little bit of carrier oil, maybe a couple drops of geranium to a couple drops of geranium to about a teaspoon or half a teaspoon of a carrier oil, like coconut oil. And then you just simply apply in the direction of the nipples all over your breasts. And you do this frequently throughout the day, but it's very important when applying essential oils to your breasts and when you're nursing to do this after the baby's nursed. If you allow enough time, let's say 30 minutes is a good ballpark range for if you allow 30 minutes, then chances are all the essential oil will be absorbed into your tissue. There may still be a carrier oil on your skin, but the essential oil will be absorbed, so it won't be a risk to the baby getting it on their face or in their eyes or ears. If you don't know for sure that that's been all absorbed into your body and you need to nurse more frequently than 20 or 30 minutes, then you might take another cloth with a little bit of soapy water and just clean off the breast before nursing so that you don't have any kind of risk of having oils get in the baby's eye or on the cheek or face. If there's any kind of contact with the baby that has a negative reaction, I recommend diluting the baby's face or eyes even with some kind of carrier oil. And that could be olive oil, coconut oil, sweet almond oil, whatever you have around is how to use that. And also it can be used to help to ward off infection. So mastitis or breast infection is very serious. Definitely talk to a practitioner if you have a fever or pain in your breast or any other symptoms of mastitis. However, while you're waiting for the call back, go ahead and use geranium and see if that might support this. And you can apply it the same way you would for engorgement with the cold cloth. You can add frankincense and tea tree oil to that mix, or you can do it as an oil. If you do have a lot of heat, then keep in mind that carrier oils tend to hold in heat, whereas like a water-based cool compress type of thing will actually help to cool the area. So that might be more indicated unless it's too chilling for the mother. So those are my tips for using geranium essential oil as a nursing mom. And I hope that you've enjoyed them and that you'll get a lot of benefit out of this oil yourself or from sharing it with others. Take care, everyone.